all so much for having me here today. As I was presented, my name is Alexandra. Originally, I am Armenian, although, just to clarify, I did leave Armenia when I was 2 years old. Therefore, most of my studies and everything that I've kind of been a part of has been in Canada. To be more exact, that's British Columbia. And in BC, what I do, and a little bit about me, is I work for treatment centers. I work for treatment centers related to addiction, and I create programs coming from a biopsychosocial lens. So that's a very important term to remember, and again, that's biopsychosocial. So what I do is I create treatment programs related to different types of addictions, and of course, we're relating to substance addictions and behavior addictions as well. Today, I am going to talk a little bit about the amygdala and the trauma responses and how CBD is extremely beneficial for any treatment therapy and stress reduction. And of course, with stress comes trauma. They're hand in hand. So first, I would like to start off by trauma. Like, what is trauma? When can we talk about trauma? What does this mean? So, trauma is an emotional and psychological injury, usually resulting from an extremely stressful, life-threatening environment. But when we talk about trauma, we have to understand that there's different types of trauma. So, what is that? What happens with our brain? What does it do within us when we say trauma, when we're talking about stress? Because we all live in a very stressful environment, and when you ask about, do you have any traumas, most individuals will respond, no, my life is pretty chill, like I'm okay. But we all have traumas. So, with that being said, to understand the benefits and the trauma responses, kind of understand what is trauma and what happens within us. So to understand that, what I like to do is kind of understand what the brain is. Like, what is the brain? What is its function? What is it meant to do? The brain is only meant to survive. Survival. Remember that. That's key. Survival. So that means is that the brain always analyzes short-term, fast results. Long-term is conditioned. Like how we go to school, how we learn things. To do long-term is learn about frustration. We're frustrated, we're angry, we're trying to do something, we're trying to accomplish a goal. That's trained. The brain's gonna be like, you know what? We don't gotta do this. It's fine. Let's just chill out a little bit. Let's do it tomorrow. So the brain is meant for survival, meaning any kind of uncomfortable level or feeling, the brain's not gonna like it. Therefore, when we're talking about survival, which part of the brain is that? Like, what are we talking about? We're talking about the amygdala. So that part, what does that do? What the amygdala does, it's a very important role it has. It's about analyzing the situation and making sure you're okay. So let's think about that. What does that mean? Am I okay? Well, it means, are you stressed? How are you feeling? Are you sick? Is there something going on that is upsetting you? So with that being said, when the amygdala is trying to protect you, it's activated. You're already in the emotional side of your brain. I like to say we have 3 different parts of our brain. Emotional side, a wise mind, and a very intellectual. Wise mind is a combination of both, of emotional and intellectual. Intellectual is very strict. Kind of like, I don't know, when the cop stops you. Police stop you, and you're like, oh, I'm so sorry, I was running late. And they're like, oh, I'm sorry, here's your ticket. Right? Wise mind would be in between, understanding, being empathic, but also maintaining with regulations. So more in our emotional mind, just the way the doctor spoke earlier, we're actually not thinking and responding most of the time correctly at all. We're responding to be active, to survive. That's it. So most of the decisions that we make are not actually beneficial long term. Now, with that being said, with the amygdala, it has different categories. So trauma has different types of trauma. We have small T's and big T's. So there's different types. But before we get to that, There's trauma responses and trauma reactions. So when the brain is trying to protect you, it's trying to protect you from the situation. So that means depending on the situation that you're in, you are going to respond with flight, fight, fawn, freeze, and flop is a new one. Even though we've all done it, and flop is kind of fainting. So I'm going to go through each trauma response a little bit to kind of understand what it is and how we can alter and become self-aware and how we're responding due to our traumas, and also the benefits of CBD in that time frame. So discussing traumas and what is trauma, and especially coming from a biopsychosocial lens. If you remember, that's what I started off with, biopsychosocial lens. So we're talking about traumas. First and foremost, we have to talk about your human body, yourself. Where did you come from? What is your genetics, your biology, any health issues in the family from the very beginning, so before anything, right? And that occurs before birth, right? So even before we're into this world, and you're inside in the womb there, it's kind of developing, it happens way before. And one thing with traumas, and right here, and I want to say a really big one, and it's part of the little t traumas, it's not funny, but it's actually a pretty big one, is frequent yelling. So let's pick up that one first, before anything. Frequent yelling. So you're not even in the world yet. You're basically in here as a baby, and your family's having trauma. And I'd like to say how Dr. Gabriel Conte actually explains how he left Hungary and he went to Canada, and the trauma that was occurring in that environment. So remember, biopsychosocial. I'm talking about the social aspect now. But the environment, you're not even born yet. We're talking about frequent yelling. So if there's things going on in your family, in your household, in the environment that you were raised, before you even come into this planet and you have an opportunity, brain frequencies and the frequencies around us affect us before we're even here. Pretty interesting. Now, after we've arrived, life goes on. Things happen. Right? We have separations, we have war, we have maybe a loss, even loss. The brain goes through cycles of loss. It's a cycle. And when we think of loss, we basically sometimes think of death. But loss can be loss of a job, loss of your loved one, loss of a friend, loss of your phone, multiple things. And depending on how we're wired and what we believe and what we feel and think, that's how we behave. Therefore, when we're talking about traumas, there's different types of traumas. There's generational trauma, there's developmental trauma, the one I just discussed earlier, when you were in the baby, developmental trauma. So not only is there different types of trauma, but there's also different categories of trauma. So with that being said, you can see how a person's ability within the world and even their limitations, most of them can even occur from even before. We're not even aware of them. Now, how do all these things affect our brain? Well, like I mentioned before, there's different types of traumas. So you have big T's, little t's, but you have complex trauma, life transitions, developmental trauma, generational trauma. So that's why we're talking about biopsychosocial. It's super important for a doctor like myself to understand not only your mental health state and where you're at, but also your biology, your social environment, what other factors are going on. And just like the doctor before we spoke of, how everything is connected. When you're feeling stress and you have trauma, that's cortisol levels that are going to evolve into your brain, which basically are going to alert the amygdala to respond in a trauma response. Flight is let's get out of here. Fight, I'm going to fight you. Fawn is very much people-pleasing. And then you have freeze, which is dissociating, and flop is fainting. So different trauma responses that are connected to different themes. And I say different themes because our brain will remember details that are important to us, but the brain, especially in a moment of trauma, fear, of reaction, it will remember the theme. So let's say an example would be, you lost a friend, they went away, you lost your grandma, and then you lose your phone. And when you lose your phone, you're like yelling and screaming and you're so upset and your friends are like, hey, it's just a phone, like relax. But that's not about the phone. Or the way the doctor expressed in traffic, getting angry in traffic. How many of us are actually just angry in traffic? There's mostly something else going on. We have anxiety, we're rushing, we're doing something, there's other things going on within us again. And that again can be due to different circumstances within our life, what we think and feel about the situation. Now, with all this being said, and before I bring in CBT and the purpose of it and how effective it is within everyday treatment, within our lives, and even just being aware of your thought pattern. So this right here behind me is from CBT, that's cognitive behavior therapy. And CBT is a great therapy technique that you could use to learn how to become self-aware of your thoughts and your emotions. Now, to start with, before we can discuss anything, to be able to behave and have a behavior, you need to have an emotion and thought. So we're talking about a neural pathway. You're talking about a situation, so a situational unit, which one situational unit, this is a different situational unit. It changes. Maybe I see a color that triggers me, maybe I like. So different emotions to different situations. Then, to have a situational unit, you need to have an emotion and a thought. So there's no way you can behave without these things. So when we're talking about behavior analysis, and like police officers know where you're going and all these things, that's why. We're humans of pattern. We have patterns. Right? And the brain, like I said, is for survival. The brain is just like a computer. It depends what we have installed in it beforehand to actually understand our behaviors. And the best part, which is not the best part, guys, I'm joking, is that most of this in the foundation is created when we're in childhood, under 18. So that means that a lot of the things that are wired and registered, we're actually not fully aware of them, which is great in that sense. But that gives us an opportunity to learn about this. So there's just a little diagram here in how to kind of be aware of these thoughts. So one example would be a situation. Let's say it would be loss, because we talked about that earlier, so let's continue with that. Situation lost, my friend moved and I'm very sad. So situation is loss. It's good to put a theme instead of the details, because the details can be quite overwhelming. What are your feelings towards that? What are your thoughts towards that? And how did you behave? Well, when they told me they were moving, I got upset and I left. Well, that kind of sounds like a flight response. So the idea is to kind of start finding those patterns. Now, to kind of get more into trauma responses, to understand what they are, like I mentioned earlier, we have flight, fight, freeze, and fawn. So flight can also be the workaholic. Have you ever heard of a person that works so much because they love their work? Well, that can be a workaholic, and that can also be a flight response. And you are being like, oh, my partner is so dedicated, works so hard, which is probably true. But where is it coming from? So that's the question. Now, fight I think we're all very common with this one. We've seen people fight. Now, all these things come from somewhere, right? So if someone is behaving with a fight response because someone, situation disrespected them and was rude to them, their emotions, they felt disrespected, they felt like their boundary was pushed, their thoughts were like, you're not going to get away with this. What do you mean? Do you know who I am? Who? Right? Is that true? Necessarily? We had to learn that from somewhere. We must have seen that from somewhere. So that's the idea of kind of learning what our trauma responses are, what our trauma responses in the first place, and even how do I become aware of this and how do I put this into practice. Now, my next slide here, I just wanted to add flop, because flop is something a little new, even though we've always had it. And flop is fainting. So we've always had that, but we've just kind of put it right now in practice. Now, most individuals that are very stressed, that are stressed, and anyone and everyone within this world responds this way. So if any of you are sitting here right now thinking, I don't have this, I'm sorry, we all do. All of us do. There's nobody that doesn't have these initial responses. The only thing we do have is awareness to be able to control it and not behave that way. Because at the end of the day, it's not about behaving in a certain way for the world. It's about, am I behaving correctly for me? Is it working for me? Because if I'm fighting at work and I'm getting fired, that's not really working out for me, is it? Right? So that's the thing about being self-aware. And this is one of the things that we also teach in addiction. Because with addiction, and I bring addiction forward because a lot of people feel like, oh, no, we don't have that. We all do. Just behavior addictions or substance addictions or all these things. And addiction is not only genetic, but it's what happens to you. That's trauma. Right? So we all have different behavior patterns that must be looked at in different levels. And because of the stress levels, because when we talk about trauma, we talk about uncomfortable. Remember, the brain is all about comfortable and survival. So when we're talking about uncomfortable, we're talking about stress, we're talking about the cortisol levels being elevated, basically, at that time we're in our emotional brain. Therefore, we're not really actually able to perceive the situation correctly. And most individuals, not most, 99.9% of individuals with any kind of issues all have trauma. And this is affecting all of us. And like I said, trauma starts before you're even born, right? Before you're even born. Frequencies, right? What is occurring? We have brain frequencies, or alpha, or beta, or delta, right? So even before, how your brain is formed and how you're developing to the environment that you're surrounding is extremely important. So it's really important to actually even realize, that's why it's important to talk to your family, to your fosters, to whoever your family unit is, blood or not blood related, to find information as much as you can. And if there was any traumatic event occurred, let's say before that or after you were born, that's also a very important factor. Now, the exercise here that I've had, and I have a few little, I printed these out, if anybody would like to have one. But this is a thought record. So a thought record, this is something that I have like in the journal, these printed out. Whoever would like to take some home, please do. This form here, we use in our treatment centers, and I use really often in my therapy techniques to help individuals become aware of their thoughts and their emotions and their behaviors. And like I said, small T's and big situations and small situations. If you have a situation where you're not actually feeling quite comfortable, and you're like, I don't really like what I felt today when I was talking to my friend, and I don't know, I had this weird feeling, well, ask yourself, what's going on? What did I feel? What was I thinking? What was conscious? What was unconscious? Right? So, and then how did I behave? Because remember, you cannot have a behavior without having an emotion and thought and a core belief, but I'm not going to get into that today. It's a little too much. But There's no way. So if we're not liking the outcome and the result, and again, it's not about, why, God, why is this happening to me? No, don't let the universe. It's about what. What is the reason this happened to me today? Like, what's the reason? What did I do? What can I do? What can I improve? Right? You cannot control the world. You can only control within yourself. So this is the first thing. Just kind of how to be self-aware. Now, the fun part. CBD. And harm reduction. Now, has anyone heard of this term, harm reduction? Anybody? No? Yeah? Yeah? So harm reduction is something we use quite frequently in treatment centers, right? So it's reducing the harm. So if you are stressed, you're upset, or you have a physical illness as well, the way Alexandra, really brought forward all her personal journey as well, and having a family member or anyone going through something medically, wrong, there's a physical illness that is occurring. And when I say that, let's dissect that a little bit, right? So when someone is ill and they're not feeling good, what happens? They're sad, they're stressed, their perception into the situation that is going on, maybe there's a great birthday party, there's some nephews there, we're enjoying that time, but you're not feeling good. Right, so your emotions are going to affect your thoughts and your behavior. Right, so you're not really able to actually enjoy yourself. So let's think about that. So if we're sick, we're not feeling good, and we're talking about a biopsychosocial lens. Well, it's not enough. I'm just going to go to the doctor, I'm going to take this pill, and I'm going to be fine. Well, hello. How about your brain? Are you feeling fine? Are you okay? Is your environment okay? Right? There's different aspects to that. When you come see a patient, it's not just like, oh, okay, you got depression, there you go. But hold on, what's going on? What do you mean, you got cancer? Okay, what happened? What other issues are going on? Right? So, harm reduction. So what is more harmful? Being stressed and angry and upset and not healing yourself? Or taking some CBD? To reduce the harm overall, right? And then, in other words, in treatment centers, and coming from British Columbia, we do have a higher number of addictions, and not necessarily, I guess, a higher number, but I think more openness and open to the reality that we all face as humans. So I don't think there's actually necessarily, because there's a lot of other addictions like gambling, substances, behavior, sex, whole other addictions, and I'm sure Romania has them too, and all of the countries do, right? So it's not that we don't see it, we do, we just don't talk about it. And this is one of the reasons I have a huge passion to be here in Romania today and come to my roots, is to bring this awareness and really understand this, right? So when we're talking about harm reduction, it's reducing the harm, right? So just think about that. So I have patients in my treatment center that are addicted to certain kind of substances, and they come to me and they say, Alex, I'm probably going to have some THC, which I know Romania is not about that. But what do I say as a doctor? I say, obviously, right? What would you do? Something that is more chemically disturbing and affects you long term, because it's made almost in the lab, or a plant. I think I'll go for the plant, right? I think so. So, reducing the harm. So not only are we talking about harm reduction in the sense of let's reduce the harm of substances, but let's reduce the harm of behavior. Because what does CBD do? Well, so what CBD does is that it deactivates and desensitizes your amygdala. Right, so when I say that, I mean that your perception to the situation now that you see it is going to change. Right, you're going to be more calm and be like, okay, what's going on? What are my options? What can I do? It's all, oh my God, this is so bad, let's go, let's get out of here. No, it's about supporting yourself. At the end of the day, it's all about you and what you can do for the benefit of you. And that's looking at the biopsychosocial events. I'm going to say this a few times. So with harm reduction, it's reducing the harm itself and understanding the harm ain't the behavior, the harm as in the illness, whatever the harm is, it's like, what can I do in a biopsychosocial lens to support myself? Not just like I'm going to go to the doctor's and the hospital and take this pill and I have another scheduled appointment tomorrow and yeah, this is it. We're working out, but I hate my home environment. I don't like who I'm living with. My husband's annoying. Well, then I don't know what to tell you. Things are not, you know what I mean? That's not that it's not going to work out. But I mean, you have more of a chance in understanding and reducing your harms in all aspects to be able to move forward and heal. So the role of CBD in emotional regulations and the research that indicates, like I mentioned before, is that it basically reduces the effects of amygdala to be able to be activated. So there's been studies that have proven that not only does it benefit you day to day if that is treatment that you're looking for, but there's been studies, listen to this, is that after a traumatic event, and again, you guys, trauma is not like a big thing. It can be something quite small. It can be a moment. It can be anything that you perceived it in a negative way that basically hurts you. Right? So that kind of, I don't know, I have like 4 of those a day. I do. Right? So it's about looking within that. So when we're talking about trauma or anything, we've had studies show that taking a CBD supplement after a traumatic event or after any event that made us feel like this is not for me, it actually reduces your perception. And you're able to like grasp the situation a little bit differently. Be like, hey, you know what? Like, I think I can do this. I think I got this issue. I'm gonna call a friend. I'm gonna use my options, my lifelines. Like, you're actually gonna think it's not just like a one-way street, like we're doomed. This is it. Or no, we're actually gonna see other options. So there's a huge benefit to that. Because remember, we need to understand the purpose of the brain. Remember when I came here, I started off with the brain is only meant to survive. Well, if that's the only purpose of the brain, you guys, we got it pretty hard. Because if that's its only reaction to survive, then we really got to take a step back and be like, hey, is this actually long-term beneficial? Or is this a short-term fast fix? And where do I want to kind of get to? The interplay between CBD and CBT, that's a mouthful. CBD, of course, we don't know what it is, and CBT is cognitive behavior therapy. So the worksheet that I showed earlier, which I think I have another slide of it afterwards, is very beneficial to work with your therapist, like myself, I'm a therapist, to support in writing and just really working together and altering those core beliefs, your emotions, and your thoughts. To be able to behave in a way that is beneficial for you long term. Whatever that is for you. So with that being said, CBT therapy with CBT, which is cognitive behavior therapy, there's also dialectical behavior therapy. These are just some therapy modalities that you can use to be able to become aware. And if you do go to a therapist, which I recommend every single person in this world to go see a therapist, you do not need to be crazy to go see one, trust me. Everyone needs to have one. At one point in their life, this is a great way to start to become self-aware of your own emotions and how things were wired. And like I said before, most of our core beliefs, which I didn't really discuss core beliefs right now, but are formed in childhood. And you cannot have an emotion or a thought without a core belief. And a lot of things that are perception that we're perceiving as young individuals, they're actually not beneficial for us long term. So there's many things that we gotta kind of look into. In conclusion, the relationship between the amygdala function and CBD influence and cognitive behavior therapy is a promising area of study. Understanding these connections can lead to improve therapeutic approaches. So again, not only is CBD beneficial for us to alter our perception, but it also supports us in altering even past traumas and seeing it, because when we talk about our trauma or our experience as well, we basically have a narrative, right? A lot of individuals that I see in my treatment centers, and they come to me and they have a past and they have traumas, and we have an assessment. It's called the Adverse Childhood Assessment, and there's 10 questions on it. And most individuals that are incarcerated in jail usually score over 4. So again, it's not, is there bad people? It's what happened to them. What's going on? So with that being said, there's a huge benefit for CBD, for this plant, this natural plant that grows naturally in the world. It's not chemically made, it's not made in a lab, like most of our medications, right? And as a person that lives in British Columbia, where cannabis is free and legal, and we have stores, and everyone is able to purchase their medical cannabis freely without any issue, it really does deepen me and saddens me when I do come to my home country and I do see the benefits that we're able to offer and the treatments and the amazing work that we create as a team and together and support individuals, and having people come to me and be like, Alexandra, like, you saved my life, or this was incredible, this treatment. And we all need support. This is one of the things that we do use is CBD. So yeah, I think that's pretty much all on my side. But yeah, there you go. Any questions? Yeah, I love questions.
I can listen in English, or how do you prefer? So, ok, o să pun la mână întrebarea, ca toată lumea să înțeleagă. Știm cu toții și ni se spune în mod repetat că THC-ul are o abilitate de a afecta memoria pe termen scurt. Și vreau să întreb dacă în munca dumneavoastră poate ajuta acest lucru în traume. Dacă faptul că sistemul imunologii modulează sistemul nervos central să activeze uitatul, că este la fel de important precum amintitul, dacă aveți succes cu așa ceva.
I like that question. That was a good question. I like it. Yeah, so short-term memory loss, absolutely. Yes, that happens with THC. And your question, if I understood correctly, is it beneficial for any traumatic people?
It's a good sign.
Yes, so it can be a good sign. So the brain initially, when any traumatic event occurs, it's going to protect you and go to survival mode. So it depends what situation it is on. So the brain, that's why we dissociate and we don't remember things. And the brain will only remember things that you need to. But the things that you do remember, and when we talk about trauma is not like, when something occurs, it's not like, oh my God, this is happening, I'm going to be so traumatized right now. No, it's about after. Right? So after something happens to me, I go and I talk to anybody and they're like, oh, that happened? Like, oh, that's pretty bad. So you're like, oh, okay, like, this is bad. So it's a narrative. It's a narrative of society. It's a narrative in the world. So your question is, does it help if we forget things? It does. It can help because you give it opportunity with EMDR therapy, that's another therapy modality, to be able to create a different narrative. Right? Because with trauma or any kind of response, like if you and I are in a situation and you remember it in a certain way, I remember it in a certain way. Now, who's right and who's wrong? I don't know, right? But it's like, is that memory not okay for you? Because if it's not, it's like, what can we do to alter it? Because that's what, at the end of the day, that's where it stands at, the core, right? How do you feel about that? So yeah, I haven't seen studies on it, so that's a really good thing, so I'm actually going to source that. But yes, it can be beneficial because it will help you alter your narrative. Because at the end of the day, nothing has meaning if you don't give it meaning, right? Like this is just a table. But if you keep it, I'm like, oh my God, that's from my grandma. That's me putting meaning to it, right? So even with a narrative or a memory, the memory is nothing without the meaning that you gave it in your own perspective. You know, another thing that kind of comes to mind is what Dr. Abraham says, very much like no two brothers or sisters are raised by the same parents. And then again, that's a memory. Does that make sense? Like different experiences. So yeah, it can be beneficial because you will remember it differently. And like I said, when you do THC or even CBD, what it does, it desensitizes your amygdala. So basically when that response of like, oh my God, we need to be in survival mode, or we need to do something about this, it kind of goes like, just shut up, it's okay, calm down.
Amygdala is kind of the fear organ of the brain.
Exactly. It's survival, like really helping you being alert. So that's exactly it. So when that is activated, you're in your emotional side of your brain. Therefore, you're not thinking clearly. You know, so when you're taking something, you're able to like relax a little bit, then you really think about the situation. You're like, you know what? Yeah, he was rude, but you know, he's my friend, and he actually has a lot going on, so I'm going to understand. So you see how I'm switching the narrative into it? So those are your thoughts and your emotions. Then your emotions switch. It's going to be like angry, fight, you're like, okay. Then you have fun with it. Okay. You know what I mean? Your narrative changes. So yeah, but that it can be very beneficial, absolutely.
And I had a second question.
Yeah, go for it.
I will say this both in English and Romanian. So we know that THC has a depersonalization effect, especially when the concentrations are too high. Do you think that can be beneficial as well for people in addictions which already has some, let's say, derived behavior? Se știe că THC-ul poate provoca un efect de depersonalizare, mai ales în situația în care concentrația este foarte mare. Credeți că poate acest lucru fi un beneficiu în tratarea adicțiilor, unde deja este un comportament adictiv schimbat?
Yeah, so with that being said, so with THC, what it does, and too much of anything, right, it's not good. Too much of sugar is not good. Sugar is actually more harmful than THC. Way, way more. So with that being said, it can, when you're talking about different identities and stuff, you're talking about, again, a trauma response. So in children that have been extremely in a trauma environment, that have been very high, they will dissociate, but there's different dissociations as well. There's identity, so it gives you identity and stuff. So with that being said, yes, perceiving the biopsychosocial form and looking within that, each individual is very different, and even what is needed for them. Although when we talk about THC, when we talk about CBD, it is way less harmful in general than a lot of our medications from the pharmacy. I'm sorry, but it is. Right? So even depression pills, side effects. You might feel suicidal and want to throw yourself out the window. Like, you know what I mean? So that's harm reduction again. Right? It's not like a promise of like, oh, okay, no, you're not going to switch your personalities. You might. I'm not saying no, but is it going to be worse than something else? Or is it going to be worse if you don't take anything? Right? And then that's even worse. So that's where the term harm reduction comes into play. Because nothing within this world is like, this is 100% perfect and safe. No. Sugar is one of the worst things that we can do, and it's in everything. And totally destroys everything. Like, so that's where the harm reduction piece comes into, because someone that has those and has different addictive personality, well, would you want somebody that has multiple personalities to be addicted to meth or cocaine? Or would you want them to have some THC? I think the THC wins all the way, right? So that's where harm reduction comes into play as well, because it's not a win situation, right? So does that answer? Does that help a little bit? Yeah, thank you. Any more questions? Yeah, I love questions. There you go. I'll bring the mic.
Do you have any experience with HHC as opposed to THC? So hexahydrocannabinol, is that used in therapy? And why?
Thank you so much for your question. Yes, actually we do. We had a patient that was actually born with a brain tumor, very big, and the doctor said that he was going to pass away. And it was very much so the days of like, no, he's not going to make it past 5, past 6. You should probably take him home, give him everything he needs, make him feel comfortable. And that's exactly what they did with the oils through anus application. That's the way it is. There's different dosages. And during that time with this patient, actually was quite many years ago, like 15, 18 years ago that I'm talking about. And cannabis and cannabis treatment and just the oils and everything was not so much still in Canada yet. They were just kind of appearing. So it was a very gray area. And even in Canada now, their first act of action as a medical profession is that you need to go through a chemotherapy and everything else. And if that doesn't work out, it's just you're under 18. But this child as well, he actually had treatments. I don't remember the dosages, and I don't want to say anything to be wrong. But although multiple dosages a day, the kid grew up to be an adult, lived until he was 36, and worked every single day actually in the cannabis store. And supported there. But yes, huge beneficial, absolutely. Pain reduction, which is huge again. Having the opportunity, because what we have to understand is that when we're taking these oils and stuff, your body is in so much pain. It's in pain, it's hurting, right? We're numbed. So you're so numbed when you take some other medications, for example, and one example I can give is like giving birth, C-sections, right? If you go and get an epidural, the chances of you having a C-section is like 99.9%. Why? Because you just totally numbed everything. You numbed your nerves, there's no pain centers in the brain. So all your nerves to your body and your mind don't connect. Right? So what does that mean? Is that your body actually does not have enough time to actually know what's going on so you can dilate and have that baby. So with that being said, what you just mentioned, that helps because that doesn't numb the pain in the sense of how other medication does. It still lets your body feel it and heal it. And that's what we need to understand is that naturally we have a lot of healing capabilities. We're actually pretty awesome humans, like living organisms, we're pretty cool. We got pretty cool stuff. But a lot of things that we have in our pharmacies and stuff is not beneficial long term. Does that help? So absolutely, yes. Amazing, amazing work and amazing treatment. And it's mostly because it numbs the amygdala, it desensitizes, but it doesn't not make you, like the body feel. It still feels, and it's able to naturally even tell you what you need. When you take other medications, for example, you don't feel your leg anymore, so you're like running, and you're totally fine, and the next day you feel this pain. You're like, oh, I shouldn't have done that. That doesn't do that. You're still feeling your body's limits, making you be able to feel. Does that make sense? Okay. Well, thank you, everyone. Thank you so much.